Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health. But these are not my labs. These are not my practice's labs. This is your body on paper. And what good is it to you if you don't understand it?
Well, welcome back to the couch in the Discovery Doc. I'm here today with the Discovery Doc, Dr. Cece.
Hey.
I'm your host, Anna Kate. And today we are going to talk about continuing our conversation from our last episode where we talked about well care visits, and now we're going to shift into functional medicine, and that's the majority of what you treat in your practice.
Yes.
And how do you know the transition of going between well care, and when does it turn into functional medicine?
Yes. So sometimes it doesn't. Sometimes I have my well patients who I see, I do like a newborn home visit, and then they're with me from birth on, and they're just so healthy and great that I never need it to turn into functional medicine. And that's honestly my goal when I get babies from the start and I really would love to get pregnant women from the start. But when I get babies from the start, it's prevention. And it's, I know their history. I know the family's history. I know what they're genetically predisposed to, and I can help parents navigate how to avoid that or how to best, just foster health and wellness as they grow up. And it depends on what age they are. But that is the goal when I get them as well, visits initially, is that I don't need them to cross over to functional medicine. Some patients come to me with existing symptoms where I see them for a well child visit, and I'm like, hey, like they have this, and this going on. I really think we need to run more of functional medicine labs. So why don't we transition over there, where when we get into interpreting those labs, it's a functional medicine visit. Because that is where I am then putting together protocols and, doing whatever we need to do to make that kiddo just succeed and thrive and grow. But yes, to answer your question, the majority of my day is functional medicine. And that happens to be adults mostly. I would say that it is, if I turn that off, it is 70% adults, 30% kids. And these are patients who come to us for a specific reason. They come to us because they have been struggling for a long time. They have tried everything. That's such a disclaimer that every patient gives to me is I've been everywhere. I've tried everything. Nothing has worked. And I'm like, welcome. And they're like, and they'll rattle off their symptoms, and they'll be like, I know this is so much. I'm so sorry. It's so much. And I'm like, no, you are a normal patient here. It's fortunate and unfortunate at the same time. Obviously, I don't want you struggling, but it's fortunate because it's not abnormal to me, right? Like you're not coming to us with all these symptoms. I'm like, whoa, I've never heard of this. I've never, seen this. It doesn't scare me when patients have longer lists of symptoms. It excites me because I'm like, let's dive in.
Let's put this puzzle together.
Yes, let's figure this out. What is going on? So yeah, it's not always does a well child visit turn into functional, but I balance a fine line between when I need it to and when I don't. But I would say the majority of our functional patients come to us for functional medicine specifically.
Right.
For sure.
So, and it is better. So back to my analogy of a house on fire. So it's better not to have the fire started at all.
Exactly.
So starting with a pregnant mom or as soon as they get in, as soon as you can get your hands on them for the well visits. But what is that? So when you have a patient that's a little bit older or already has symptoms, how do you figure that out? And how do you walk through all of that information and know, okay, what's the fire? What's fueling the fire?
Yeah.
Does the candle that's in the kitchen on tile and there's no actual active flames in there other than what's in the candle, what do I need to treat
Yeah.
first? How do you navigate kind of through all of that
All
with a new
that.
patient?
So new patient appointments are an hour for a reason. And it's 90% of the time we're going through history because a lot of times, and I've been there myself, it wasn't until I came on to the other side of being chronically ill, was that I didn't realize where my trigger started, right? I thought that it was just an accumulation of time and things snowballing. And then looking back, I was like, oh no, my trigger was a vaccine. Um, and so for my patients, it is I listen and I ask them a lot of questions, questions that sometimes will be a little challenging. Sometimes they won't recall. They'll have to call in, their
Mm-hmm.
parent. Even an adult patient will have to call their parent, be like, I don't know the answer to that because history tells me so much.
Right.
It tells me so much, and oftentimes in my brain where their health history comes down to is much earlier than where they think. And so I have, patients who are 50 plus, and I will ask them, hey, in childhood, any recurrent illnesses, any recurrent antibiotics use, any steroid, were there any chronic conditions, lots of ear infections, lots of strep infections? What was going on when you were, 5 and under?
Yeah.
Like, what do you remember? What can you tell me? Because those first couple of years of life are so crucial to
Mm-hmm.
how we develop, how our microbiomes develop. So it is navigating their history and picking out just pertinent points that then trigger my brain. So as you're talking as a patient and you're like, yeah, now that you say it, by the time I was 5, I probably had like 8 to 10 strep infections. And I'm like, strep antibodies. I'm writing
Yep.
down things that we have to look at, even if it was 50 years ago, because these
Right.
are all things within the immune system that can snowball and like retain this heightened state of, an immune response to that we are then reacting to 20 years later.
Right.
So a lot of it is history. So I would say about half the labs that I recommend for a patient are based on what I hear in their extensive history. The other half is the questions I want answered and based on their symptoms.
Right.
So I never want to run labs and give you problems,
Right.
right? I want to run labs and say, okay, I am seeing that you are super inflamed. I'm seeing that your white blood cells are kind of angry with each other and you have something chronic going on. And I'm seeing that your immune system is somewhat attacking itself.
Mm-hmm.
I don't want to just give you that. What the
What would
heck
you
are
do with
right,
that?
right. What the heck are you supposed to do with that?
Thanks.
Yeah.
Merry Christmas. Happy birthday. What do we do?
Yeah. Because then you go home, you Google all the things, and it ends up in death or cancer when we
Right.
Google anything, right? So I want to be able to give you those markers. And the reason why I test some of those things are so that I can see your baseline. And as we get through treatment, I can show you how your immune system is working better, how you're less inflamed. But in that initial kind of follow up, when we review all these labs, I also want you to know where it's coming from. So I
Mm-hmm.
want to say, hey, yeah, your CD57 is low, your immunoglobulins look off. It looks like something more chronic is going on. And over here, here's why.
Right.
And then we come up with a plan with that why. What do we do? How are we going to treat this? How are we going to eradicate this? Because then it's not as scary
Yeah.
for the patient to have all these what ifs and all these question marks. But then when I start going through the whys, patients are like, oh, wow, this makes sense. Like when I start explaining the symptoms it can cause, they're like, this is what I feel,
Oh,
you
okay.
know? Yeah, like, and
Okay.
it's a little scary, and I don't like that I have, X, Y, and Z, but wow, it gives me like a burning sensation in the bottom of my feet, or it could make my tinnitus much worse, or could, contribute to the pot symptoms that I'm having.
Mm-hmm.
Wow. Like this is cool to know that there's an answer and there's something to be done
Right.
about it. And that's super, super satisfying. So Did I answer your question? I feel like I just started
I don't remember
talking about.
Yeah, it's all the, but again, it's all the things of getting into that functional space of, it's not just acute. Again, it's not acute care, it's chronic care.
Yes.
Like,
And it's giving solution. So a good example for you also is like an ANA, right? We talked about this a little when we were talking about your story. Is a positive ANA or anti-nuclear antibodies. It means the body has developed these antibodies that are starting to attack yourself, your own tissue, right? It's starting to view yourself as foreign. And conventional medicine says, okay, this is happening in your body. Here's a steroid to suppress that immune response, right? I want to know what they're trying to
suppress.
Yes.
What they're trying to attack.
What they're trying to attack, what they are trying to save you from, essentially. What are they going after? Why did they turn on? That's what I want to know. And so I'll always, patients come to us on medications and on things, and I will never change, like step on any other provider's toes. I'll never rip something quickly from a patient, especially someone who's been chronically struggling. That steroid is going to stay there. You're going to check in with your specialist. You are going to keep those, physicians and that team on board, but we're going to work over here. And we're going to not interfere with anything that's being done over there, but we are going to figure out the why. What is reacting in your body? What is on fire?
And that is so much easier to, instead of going in and blowing out the candle, like figuring out what the fuel source is that's doing this that's the house fire. The house is on fire. The alarm bells have given up because it has been so long that this fire has been raging. And am I eating something? Like we talked about our food sensitivities. Am I eating something that's lighting extra candles that are adding to this problem? They're contained and they'll go away, maybe, or not, or whatever, because they're isolated incidences. But kind of going back to the testing and you kind of having an overall, we've talked about before being kind of what's the word? Like part of the medical team of looking at it in such a big picture that yes, specialists need to do their specialist things these are things that I do not do. I understand somewhat of them. I want to look at everything. But getting the baseline of labs, and then I've got some me personally, I've got some resources that I can put together in our community for you to be able to track them yourselves of knowing, okay, we did this CD57, my white blood cell count was this, my lymphocytes were at this. And then so that way it's easier for you as the patient
to track it
and know what all this means, because you get all this stuff and
it can be overwhelming.
Then what do you do with these numbers? And the testing rate, or if you're outside the testing rate and you don't know, and it just says high. Well, what are my numbers that makes it high? And where do I want to shift and test that? Like, what is that really? What is normal in the rate of how they tested those 100
people?
Call
on me, T.O. Okay. Yes, because I have an issue with this. I have two issues with things that you were just talking about. Number one is that I can't tell you how many of my patients come to me after, most of them have seen specialists, right? And they upload labs, any recent labs. I asked for anything done within the past year. And I'll skim through them before I go in to see the patient. And I will pick out certain things that I personally see on those labs. And I get to the patient, I'd be like, hey, going through your labs, and did you know that this and this are going on? Or this is my interpretation of what I see. And they're like, no, nobody went through them with me. Like they sent them to me and said that they look fine. And I'm like, okay, but the issue is that these reference ranges are not fine. So LabCorp reference ranges it's sick America. It's comparing you to sick America. Right. We are the #1 country for chronic illness in the world. So why do I want to compare you, my patient, who I'm trying to get to a space where you are as optimal as you can be? Why do I want you similar to a sick American? I don't. I want you optimal. And so I'm looking at those reference ranges, and mine are half of what LabCorp's are in terms of, even something simple like thyroid function. I want that T3 above a 3.2. 2.1 is not normal. That is low. But according to LabCorp, it's normal. So I dissect those labs in a way that conventional doctors do not. Nothing against them. It's all about the training. But it's a lab value that is compared to Sick America.
Right.
So I see those and see flames everywhere, whereas someone else seems to say that they're fine. And I went through that personally for years and years and years, where you're told, but your labs look great. They look fine. They look wonderful.
But I'm not fine.
But I'm not okay. Right.
It looks good on paper, but I'm not okay.
Exactly. So I just, in the field that I work in and the patients that I get, I've had to learn how to evaluate those common labs in a much more specific way to give me flags. And I say this all the time to patients. I'm like, hey, these are yellow flags for me. They're not red flags. Some are red flags, but these are yellow flags to say, ooh, this might be going on here. It looks like maybe there's something, chronic viral going on. And these are the more specific labs that I need.
Yeah.
So it's just a very different take, but I will never turn down when a patient is seeing specialists or when they're doing imaging or doing any of that. I will never turn it down. Why? Because the information, it's better to have the information. Right. I would rather you get that information and there's nothing, air quotes, nothing that can be done about it, or there's some sort of answer. I don't ever want to discourage a patient seeing somebody else or following through with their specialist, because if there is something that's missed, that is what I think about. Because a lot of patients come to me and they're like, well, can I stop seeing my endocrinologist now? And I'm like, no, not right now. No, like that's been a core part of your stability or where you are. Let's just keep things status quo until we see what's going on. But I will always take that additional information. What we do with it is a different story, but I will always encourage that extra information.
Right. And it's also, again, going back to having a medical team that, you're looking at things from a much wider perspective of what is optimal. Like, what are the things that we can do for you, and look at all the things. So if you've done, discover, this is for you. If you've ever done labs, find them all, all of your records and kind of categorize them and see what your patterns are, because your baseline or your reference range is your reference range. So it's not, again, we don't want to compare ourselves to Sick America, but what your number, how they track. And I'm chronically, my white blood cell count is low. Like 3 is a high number for me, but I can go and see it's 1.2, 1.3, like all of those things. And then it's progressed where 3 is now kind of normal for me. But I wouldn't have known that. And 3 is still not optimal for, so it's not.
I like it about 6.5, 7.
Yeah. Yeah. But for me, it's a big change from 1.2 for years. So having your reference range as an individual provides more information over a long period of time rather than comparing to.
Exactly, because not everyone fits in the box. There is, like you said, your reference range is your reference range. Your baseline is your baseline. So that's also very important to know. And women versus men too. And just where we are, and things like that change all the time too. What was going on? Was it a stressful time? Were we sick? What did we have? Was it crazy at work? Were we dealing with 4 kids at home? Like what was happening? Because our cells respond to that too. Right. So it's great to understand your body. And I don't think a lot of people do. And on the flip side, or I shouldn't say that they don't, it's that we're not educated on how to.
Or how to pay attention to a headache's just a headache. No, it's not. There's
it's not
something else going on.
Right. PMS is not normal. Headaches are not normal. Bloating after every meal is not normal. But society likes to tell us that these things are normal. But one thing that I try to do, and my follow-ups are super thorough because of this, and Heidi yells at me all the time because I take forever.
Heidi, quit yelling at her.
I know.
She's doing a good job.
I'm doing my best, okay? She's my nurse. She runs all my patients, but it's because I like to explain everything. And I say this, I'm like, this is your body on paper. All of these labs are, yes, they're, it's at my discretion to suggest what labs to do that's appropriate at this time, but these are not my labs. These are not my practice's labs. This is your body on paper. And what good is it to you if you don't understand it?
Mm-hmm.
So no, I don't have the time to sit in there and, go through everything I've ever learned in my life and how I come to the conclusion of interpreting those labs. But you better believe that my patients walk out of that meeting understanding the ratios, understanding what I'm looking for, understanding what we need to improve, understanding the things that are there that shouldn't be there. And I mean, it takes an hour, sometimes an hour and a half to go through all these labs so that you're not just getting a piece of paper that tells you what to do and you have no idea why.
Right. And it's so important, and it is such a game changer of being on the receiving end of, because I've worked with you before in the past of like, she's like, tell me your story. And then she's like, okay, well, these are the things that I want to track and check and do. And then when those results came back, it was like, okay, this is what this means. And you asked me last week, what are your lymphocytes and your neutrophils? I'm like, I don't know. She's like, what? You don't know that number? Like your phone
like
number?
Off the top of your head? Yeah, right.
No. I mean, I can go and find it. Like, so, and of course, going into, we'll do a whole episode on my binder of putting it into a spreadsheet. So, that once, cause it's a little overwhelming starting from scratch. If you're chronically ill, like I am, I have had a stack of papers that I had to go through and organize and get all that information. But when you have new tests done, putting that on a spreadsheet and creating a thing, because once you put everything in, it's just easy to go and fill in.
Right.
But then I can take it to a specialist or another doctor, and I can bring it into her office and say, okay, this is since 2016. Here's all of my labs. She's going to notice a pattern faster than anything else. It's going to give her way more information than I could just sitting there talking to her and telling her all my history. Then that she can ask pertinent information about, hey, your lymphocytes go like this, like what's happening. Like, so what happened in 2018? What happened in 2012? Oh, I had a pulmonary embolism and was anemic and my life was super stressful or whatever it was. And she's like, oh, well, this is reflective in your labs. So she can look at it in a different perspective and then say, these are the things that we need to watch and going through and all that. So that's where the functional medicine knowledge and big picture has been instrumental in my own life. And I know that that's how you run your practice and just getting that.
Yeah. And on the flip side, it's not just useful if you're chronically ill. It's useful if you're super healthy too, because I would love to have healthy patients, but it's not the reality of our world. The reality of our world
is sick care, not well care.
Yes, is that I do get mostly sick patients who come to us for a reason because they know what we treat, how we treat it, and what we stand for, and that I won't stop. Like I won't stop until I find certain answers and give you some new insight to your health or what's going on. Like I will not stop asking why, but on the flip side, we do have patients who come just for wellness. And I love that, where it's instead of going to a regular PCP, they come to us and they're like, hey, I'm great. I'm healthy, 50 years old, super active, eating well, cognitively feel great. I just want to stay that way. And I'm like, yes, let's do that. And even in that sense, you go to a walk-in clinic or a normal PCP, and their yearly labs are a CBC and a TSH, right?
Yeah.
So white blood cells and one little marker on a thyroid. And I'm like, yeah, that's not really preventative to me, right?
Yeah.
That's very basic information. So I will run a very comprehensive, still through insurance, but I'll run a very comprehensive lab for those yearly patients. And then we can keep track of things like liver enzymes, white blood cells, T4, T3, ferritin, iron, whatever it is, B12 levels, micronutrients, to see, okay, are you taking anything like supplement wise? Have you changed anything? Do we need to add something to keep you healthy? And hormone wise as well. Always check hormones. I love those patients. I love to keep people healthy because I wish that was focused upon more.
Right.
And I wish it was just a little more comprehensive as the norm to look at the body holistically and not just 3 stinking markers.
Imagine that.
And also, can I just say while I'm ranting, like
soapbox, get up there.
Like with a lipid panel, right? If we're running a cholesterol panel on somebody and the total cholesterol is high, and then a normal PCP is like, here's a drug, right? Your total cholesterol is high, here's a drug. When I get patients, I'm like, yo, can we do some math here?
Mhm.
Can we do some division? Because let me show you that this doctor who just put you on a cholesterol drug for the rest of your life, let me show you how your cholesterol is actually optimal. Because people don't understand that the LDL plus the HDL equals your total cholesterol. So if you have amazing HDLs, which are that good cholesterol,
Yep.
that's good brain fuel, and your LDLs are just, slightly elevated, maybe 105 or so, that's an amazing cholesterol panel. But your total cholesterol will be high because that HDL is contributing to it.
Mhm.
And the patient will sit in front of me like, oh my gosh, like I have this prescription sitting at the pharmacy, and I'm like,
Don't fill it.
no,
Don't go get it.
like anybody who follows Mediterranean diets, they will have very similar lipid panels,
Right.
and arguably those are the healthiest humans.
Yep.
So can we just stop for a second to do some math and not just throw people on drugs to do it?
Right.
Can we do that?
Mhm.
Can we?
Let's do that.
Okay, let's do that.
Again, it's understanding your body, what's happening, what's going on. Like, so, there's the pre-diabetes panel. It's like,
Yeah.
okay, let's look at your diet, your exercise, and are you hydrated? If you can
Yes.
address those three things, probably fixes a lot of what
Yes.
Western medicine would just throw a pill at.
Right. And there are
So.
so many, anyone in that like 5.7, 5.8, 5.9 category, there are so many good natural agents that we can, yes, lifestyle is massively important there, right? But genetics also play a part,
Mhm.
to do in it. And so there are some natural agents that are awesome for those people right on the cusp that, hey, let's do this for the next couple months. We're going to keep it on our radar. We are going to absolutely retest you, but I'm not just going to jump right to metformin or, a drug. There are so many other things that can be done. And I think that is that's one thing that's a little different about me when I practice is you have people, practitioners, whether they are PAs or naturopathic doctors or nurse practitioners or whoever in the functional medicine field, and they are heavy on the naturalistic side of things, which is amazing. Um, but I try my best to cherry pick. I
Mhm.
try my best to take the best sides of all medicine. There's a place and a time for every type of medicine.
Absolutely.
Conventional medicine is life-saving, in certain situations. It can also be detrimental in certain situations. But hey, so can herbs. So it's about picking and choosing the best aspects of all types, whether it's homeopathy, vitamins, minerals, herbs, and prescriptions and peptides and whatever it is, and being able to choose the most appropriate option for that patient
Right.
and being able to combine all those worlds together instead of being like anti one side or anti the other side.
Right.
Because
it does take both, and and I have that personal belief as well.
Yes.
For me, is I'm not opposed to taking a prescription. There's ones that I have to take, but I do want to do what I can do as an individual with my nutrition and moving my body and hydration and kind of all of that. But then if there's another option on the more holistic side
Mhm.
of, okay, well, can I take this that doesn't typically have a side effect?
Right.
Can I do that to help support to make me optimal? But I'm not saying no, I'm just not going to take a prescription.
Right.
Like, I understand why I'm taking it and why and what else,
Yeah.
right?
Yeah. And I try my I don't try. I do. I respect my patient's wishes. And so I will never like I do have patients who are, and I mean this in more like of an acute setting. I'm not someone who's prescribing medications for you to be on for the rest of your life. Like, don't get it twisted there. But I do think that there's a space where medications are needed,
Mhm.
100%. I just don't believe it's a solution to a long-term problem. So I do have patients who come to me who like we try to compound as many medications as we can just because they're a little cleaner in terms of ingredients. But where I will be, maybe I don't know, treating some sort of candida infection and I use like a systemic candida infection. I use multiple different agents. I usually use two natural things and then I come behind that and I do compound nystatin,
Mm-hmm.
or diflucan. And some patients are like, nope, I don't want that. I want nothing to do with pharma. And I'm like, it's compounded, like it's a little different,
Yeah.
but still, I'll explain the difference. And they're like, nope, I don't want it. I'm like, okay, great. I have no problem with that because I always have a natural option where if a patient declines some sort of prescription, phenomenal, fine, we'll do it this way. And I always ask because yes, a lot of my patients have a really bad history with conventional medicine. And so they group that prescription into that
Right.
experience and they just want nothing to do with that. And so I will absolutely respect that. I'll find, I'll incorporate, for that candida infection, whatever is a third natural agent to make sure that we are inhibiting that fungus. We're making sure that we're treating it for long enough, et cetera. And then the same on the flip side where they're, totally forward and I'll tell them efficacy and how things, work. And they'll be like, yeah, let's do that. I'm like, great.
Yeah.
Perfect.
Perfect. And I do think that
Very
that's
flexible.
also, and we can do a whole episode on kind of the going from, big pharma prescriptions to compounding to, homeopathic natural remedies, and then even down to herbs and tinctures and kind of all of that and going through that whole spectrum. I had a really good question. Then I said that. Dang it.
But that's a good point because I like to intermix all those together. It's especially for acute, like things I'm treating more acutely. Okay, we find out that there is a Bartonella infection. Okay, I'm going to treat that for the next 6 to 8 weeks and then you're done. So you're only taking this prescription if there is a prescription on there for the next 6 to 8 weeks.
Right.
I cannot emphasize the fact that I'm not prescribing a drug for a patient to be on long term.
Right. Right. And we also want to know understanding why we're taking things that you've prescribed or suggested for a short period of time. Because I've gotten so many things that end up in my basket. It's like, okay, well, you need to do this, this, and this. And it's like, okay, why?
Right.
Like, why am I taking, I know that you told me in the office, but I don't remember why, but I want to know.
Call on me. So one thing I do, and this is part OCD, but part also because I've been the patient. With a practitioner, we both know. I've walked out of the office when I was sick and been like, what the heck? Like, what just happened?
Yeah.
What am I doing? What is this? I don't even know why that prescription get called into the pharmacy for me. I don't like that prescription. What am I doing here?
Right.
Why am I changing this? Why am I taking this? And just confused. And I never want patients leaving my care being confused. And so I know I'm very logical. I know that when we have an hour to talk about 6 labs, and these are 5 pages long each, you are not going to retain all that information, but you'll sit with your pen, you'll highlight certain things, you'll take notes on there to remember, little just kind of keywords. On my treatment plans, whenever there's a prescription or a supplement or just like a random tidbit that we talk about, I'm writing it down.
Right.
And I'm writing down why. So even for a prescription, I'll put in parentheses what it's for, what it's treating. For the supplement, I'll write in the notes why you're taking it, what it's doing, how long you're taking it for, when you're taking it throughout the day.
Right.
And I'm super OCD about that because I want you being able to look at that paper and being like, just, your light bulb's going off and you're like, oh yes, okay, we found this infection and this is how we're treating it. And it says right here that I have to do it for this long and at these times. So yeah, I never want patients walking out feeling unsure or why they're taking it. I always also, or I write it down also because I want you to be able to research. Like if there is a peptide I'm suggesting, I want you to be able to go look it up, see what it is, see the literature behind it, and make your educated decision if you actually want to do it or not. I don't want to just tell you what to do. I want you to know, why I'm suggesting it, and then for you to make that educated decision.
Knowledge is power.
Knowledge is power. Yeah, exactly.
Well, you do an actually phenomenal job at that. So for you discover out there, ask the questions and write things down and know things. And, you could always, send an email to your practitioner of
why.
Yeah.
Yeah. Ask why. I don't care if they get annoyed, and people only get annoyed if they don't know the answer.
Yeah.
That's what I find. But ask why. And if they can't answer your question, then they're not the practitioner for you.
Right. And they want you to get better. So if they are annoyed or say, oh, well, it's on your sheet. It's like, no, you listed it out, but you didn't explain.
Yeah.
Like so yeah, I found out the other day that when I was taking methylene blue, like, hey, it would have been really good if I went out in the sun an hour after I took it. Didn't learn that.
Yeah.
Like, what else can I do to optimize what I'm doing,
Right.
when to take it, when, like, I also found out not that I need to know this, but you might need to know this, discover that if you're having morning sickness because you're pregnant, how's your magnesium levels?
Yeah.
Because it alleviates some of that morning sickness and that nausea.
B vitamins as well.
Yeah, if your magnesium is low.
Yeah, very simple things.
Vitamin. Hello,
I know. Yeah, just always ask why. It will never be annoying to somebody who truly wants you to get better, who truly knows the answer and wants to help you. I find that practitioners shut patients down if they are just one, you're in a practice where you're just cow, you're herded like cattle. But two, where it's just like they're so in the box that you are either in the box with them or you're crazy, right, or you're non-compliant or you're something else just for asking questions. If that's happening to you, you are in the wrong space, bro.
Yep.
And I promise you there's practitioners out there who won't judge you or who will actually just listen to you and take your symptoms that you're having and understand that they're real and it's not, just in your head.
That's important.
Yeah.
You feel, especially with having something chronic, you feel unseen because you know that it's real and you're experiencing it, and going to a PCP that doesn't understand.
Yeah.
And then going to a functional medicine practitioner that understands and can ask the questions, it's a world of difference.
Yeah. And I think that's why I have kind of innately fallen into the Lyme world, is because of my experience and because I can relate to how those patients feel and the symptoms that they say. They're comfortable saying it because they know I've been there. They're not going to go to a primary care physician and tell them that, they have a feeling like their insides are vibrating or like there's a guitar string that's just being plucked on the inside of their organs. That PCP is going to look at them and be like, okay, what drug are you on?
Yeah.
Whereas I'm like, I know exactly how you feel. Like it feels like, it kind of bumps around for 30 seconds or so and gets like deep in there. And then it kind of settles for a second, then it might come back. And they're like, yes.
What is that?
Yes. What is that? And they're like, and why do you know? Like, why did you just pinpoint those words? And I'm like, because I've been there. I've been there. And there's some symptoms that I never had, that patients have, but I will never judge that because I know how many quote random symptoms I had and went through that were extremely real, that I will never say to a patient that's, oh no, that is odd. That's weird. Like, you might want to go see psych. That's probably just anxiety. Oh,
hysteria.
Everything's anxiety. Yes.
Oh, she's not a woman that's having hormonal issues. She's hysteric. She's
right.
Fine.
She needs an anti-anxiety drug. But I do, on the flip side, one thing that's important kind of in that chronic Lyme world to talk about is like the healing journey too. And I think that also makes us a little bit different, because I also learned this personally, is you can take away what's going on that shouldn't be there, but that doesn't magically heal the body.
Right.
And there are so many things that need to happen to get someone who has been chronically ill back to a space where they do feel optimal, where they're able to run their own business again and wake up and feel good every day. Now it takes a while because we all ebb and flow with our energy, with our stress levels, and for me, for example, it took me years and years of therapy to kind of look past being chronically ill and understand, I got 3 kids, I run a practice, I'm tired today, and that's okay. This is not Lyme tired.
Right.
This is just a normal everyday, I just need to get to sleep a little earlier tonight. But it's so important to go through that healing journey with my patients as well, where physically, cognitively, we need to utilize other modalities to heal the body. And sometimes that's IVs, sometimes that's peptides, sometimes it is stem cells, sometimes it is, like PEMF and pulse and infrared and other modalities that I don't offer, where I'm saying, hey, this is really great. Look into this person, see if you can find this near you if it's not out of state patient, because that is so often missed, where patients will feel good after you get rid of these things and then they just depart.
Right.
And then 6 months later, they're like, but my joints are still hurting. Yes, because you got to heal the damage that was done.
Right. Remember we talked about that Swiss cheese? Like you gotta the holes have to
gotta
be
fill the holes.
Filled in.
Yeah, so then you're just cheese and not Swiss cheese.
Yeah.
Who likes Swiss cheese anyway? Sorry if you guys like. I've never liked Swiss cheese. Like I don't like it.
You're not an Emmentaler fan?
No.
Well, it's good on something. But she's also
no.
We'll find out about this in our next episode when we meet with Will.
No dairy. No dairy in our house.
So, but that's different of why you don't like that cheese, and that's okay.
Yeah, it's a taste thing. It's like blue cheese.
I
will
like blue
actually
cheese.
vomit if I have blue cheese.
Yeah. No, so I'm mold averse in any like fermented things. Fine, no problem. Mold is not. I can't. My body has.
And I've tried it several times as an adult, like a little tiny snippet, and it's just gnarly. No offense, y'all.
So we are at. Do you want to go through your case studies, or do we want to do that in another episode?
I think it's important to talk about one. Yeah, okay. Because I think that just on the topic of functional medicine, we've talked so much about Lyme patients and co-infections and all these other things, and not every patient is chronically ill because of Lyme or co-infections, right?
Right.
There are tons of Crohn's, IBS, IBD, chronic gut issues that we deal with that always have an underlying reason as well. I love my Crohn's patients. But also kids, kids struggle with things very differently. And just it was probably 2 months ago, we had a 6-month-old come in, and the 6-month-old had not gained not an ounce in 8 weeks. So in 2 months, the 6-month-old, which y'all know babies grow like weeds.
Yeah, they gain a pound a feeding most of the time.
So the fact that we have a 6-month-old who has not gained anything since 4 months, he's very small. He could not have a bowel movement without being stimulated rectally. Hives everywhere, unexplainably. Severe cradle cap, severe eczema, just inconsolable, fussy, you name it. Mom had been in his little short 6 months of life. Mom had been to multiple specialists in and out of CHOA.
Mom was fussy too, huh?
She's amazing. I love the mom. She was trying to find answers and she wasn't finding them. They said he had the best she got was that, he has reflux. Add a little like oat or rice cereal to his breast milk. And she did that. And 2 months later, nothing. And they're just like, we don't know. Like failure to thrive. This kid was failure to thrive at 6 months old. And we got him. I put my hands on him and I put him on a protocol just based on those current symptoms that he had, supporting the gut, decreasing histamine levels while our labs were pending. And also lack of motor control. So he was not at 6 months old, he was not rolling either way. And he was having a hard time with kind of grabbing things, holding on to small things. 5 days later, y'all, 5 days later, the mom comes in, tears in her eyes, and she's like, he's gained a pound.
See, I told you.
He's gained a pound, and he pooped on his own. His skin is already looking better. His cradle cap is almost gone. And that was just me putting him on what I consider a very simple protocol based on the history, based on, what that kid was presenting with at that time, without any labs. And so now fast forward, and this kid, his eczema is clear, cradle cap is gone, great poops, great pee, urine diapers. He is thriving. He is sitting up. He is a chunky ham. And I'm just like, for me, it's a weird position for me to be in, because for me, I'm like, that was easy. that was easy.
Because you looked.
All I had to do was listen and look. That's all I had to do. But if I had just gotten my hands on this kid 2 months prior, like what I struggle with is like that kid wouldn't have had to go through what he went through by the time he got to me.
Yeah.
And it happens a lot, but obviously I'm very thankful that he's doing amazing and thriving and all of that. But I just think it's important that if there's just always something that can be done. You know, I'm not going to promise to cure everything on the planet. It's not possible. But I promise you that there is always something that can be done. And whether it's me who finds it or somebody else, as an advocate for yourself or an advocate for your kid, just don't stop. You know, if you know innately that something doesn't feel right, that that your kid is not doing well, don't take whatever quote whoever they are, don't take that for the only answer.
Right.
Keep going until you find someone locally or wherever that can help you just approach whatever you're going through, your kid's going through from just slightly a different angle. And that's my goal. When patients come to me, I'm like, I tell myself this. I'm like, I have to look at this unlike what anybody else has looked at.
Right.
I know that all the imaging is done. I know that all the normal labs are done. So what is missing? And that's what I want to find, no matter if it's a 6-month-old baby with failure to thrive, a 35-year-old who's chronically ill from Lyme, or a 70-year-old with Crohn's, and everyone in between, is what is missing here.
What are we not seeing? What piece? There's
Yes.
a piece to the puzzle that's just
a piece to the puzzle. Yeah.
So, and it's kind of hard.
Exactly.
You kind of know what the picture is supposed to look like, but everybody's picture is different. So it's phenomenal that you can do that, and that you can look and say, okay, well, they call it medical practice for a reason, but you have application with the practice that it's like, I'm not doing this for just no reason. There is a reason, and explaining why.
Yes.
And that his motor function and his cognitive function increased by giving him what he needed and turning off the things that didn't need to be there.
Exactly.
Like, that's incredible.
I mean, yes, it is. It's very, those situations are extremely rewarding. It's not always that easy. I promise you that, but that is a good example, just how the mom knew. She was like, there's gotta be something else.
Yeah.
And she knew of us because she was a patient of a different naturopath, and knew of us, from just having that experience. But she just knew something was up. She knew something was wrong. And she was like, I just need someone else's opinion here. Yeah. And sometimes that's all it takes.
Yep. Fight and advocate, not only for yourself, but also for your kids. And I think that has got to be the most frustrating thing, is that you take your baby somewhere that's supposed to have answers and that's supposed to know. And then they tell you, oh, well, just do this. And it doesn't work.
It doesn't work. And then you get bullied into like, well, this is either you're doing something wrong, or, well, this is all that can be done, so just keep doing it. And they pressure you and bully you into feeling like it's all that I can do then.
Right.
And just, I want people to feel confident enough in themselves, and in their kid to challenge that. And you might not do it outwardly. You might not be like to that doctor, be like, no, and argue them and be like, this can't be it. But take that information, sit with it, see if your instincts are aligned with what that person is saying. And if it's not, then go elsewhere.
Yeah.
Keep going.
Yep. I mean, you and I went through that in our own journeys. We went through you went through what, 30 something doctors?
36.
Yeah, I had probably 10 or 12. And most of them were specialists and couldn't figure out what was going on with me either. But it's that thing, you have to. If it is not, it took me almost 10 years to start to get, I was treated, but to get the help that I was making progress, wasn't instantly better. I'm still in the midst of my storm, but I now have a shelter over I built out my boat a little bit, that I'm not completely bombarded all the time, but I'm still not in rough waters.
Right.
So
just keep swimming. Just keep swimming. But if y'all need help, Please always feel free to reach out to our practice to Discovery Wellness Group. We see patients from all over. You do not have to be in the state of Georgia. I just want to be a resource and a help, even to guide you in the right direction. You can absolutely do that. You can email us at newpatient@discoverywellnessgroup.com or give us a call. Regardless, we are here for y'all.
And we'll make sure that that is linked in the episode description and in the show notes. So yes, if you have any questions, and then also, I know we kind of talked about this in our well care visit, of there's some things that are in the pipeline to be a place for you to be that resource.
Mhm.
So you can go and look at the stuff and find,
Some extra support.
Yeah. So we'll be telling you more about that as we develop that. And we want to make sure that you have all the resources. So part of your homework discoverers is make sure that you have all your labs. If you haven't done labs in a while, go get comprehensive labs, get as many as you can. A full go get your labs from her, request from her office, right? So she's going to be able to see that. And then you have something, even if you feel like you're the healthiest that you've ever been, it's good to have those numbers and do that, if not yearly, which would be preferable, but as maybe every other year or so, and just to kind of, because then you can head things off at the pass as you age and move through life.
Yes, exactly.
So, more information, knowledge is power.
Amen to that.
Yeah. So on our next episode, we're going to meet her better half. He outpunted his coverage and got her. So, but he is absolutely fantastic. So we love him, but you'll get to meet Will in our next episode.
Yep.
And so they're a fantastic dynamic in how they do things as a team and move forward.
Yeah.
So I'm excited to share that with y'all, and it's great. It's great.
Me too. Thanks y'all for joining us. We'll talk to you next time.
Let's discover together.
Hey, Discoverer, let's discover more. Find episode link in today's show notes. Follow us on Instagram and TikTok @The Discovery Doc. Connect with us on Facebook @The Discovery Doc. Like and subscribe on YouTube. Find us wherever you listen to podcasts. Visit our website, thediscoverydoc.com. This podcast is produced by Soulpreneurs Association and powered by soulsoftware.co. Empowering your digital journey with innovative solutions.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.